Okay, so this is an oxygen cylinder. We have different sizes. CD is the main size for the ambulance in terms of in the portable bags and when we're taking them out to patients. With this one, if you put it on 15 litres, so you've got the turning on part knob here, you ain't got to twist it all the way. You've got on and off usually, it's usually black. Three turns is enough. After that, you've then got the tubing that goes into this port here. And then after that, I don't know if you can see it, you've got the amount here. And then just here, you've got the numbers on what litres you want to go on. If this was on 15 litres and it was full, it would last half an hour and then you'd run out, give or take. So remember, the oxygen goes there. I'm going to put this down here and we're going to talk about this device here, which is the bag valve mask. So as you can see, you've got the tubing that goes into the port that I just mentioned. You've also got the reservoir bag, the inflatable bag, and you've got the mask, different sizes. And you've also got a valve. So the valve is one way. Air comes through, oxygen goes through, it doesn't go back in. Now what I need you to do is take a deep breath for me, okay? So let's all just take a deep breath together, okay? On 3. 1, 2, 3. And out. Well, I don't know about you, but I feel much better now. So when you do that, we breathed in approximately 500 to 600 mils of air, okay? This chamber can take 1.5 litres of air, okay? So when you're squeezing the bag, you don't want to squeeze it all the way. You only need 1/3 of this, just enough for the chest to rise and fall. Now, let's say that this is not hooked to the oxygen, and let's say it hasn't got a reservoir bag, okay? And let's say you're just delivering air, oxygen like this. That will deliver 21% of oxygen, same as the atmosphere air, okay? When we have the tubing on 15 litres with the oxygen, but no reservoir bag, that delivers 45% of oxygen. When we've got the tubing to 15 litres and we have the reservoir bag, it delivers 85% of oxygen. So there's two ways to give oxygen via a bag valve mask. There's the CE grip, which is one-handed, and then there's the two-handed technique, which is the V grip. So I'm going to show you both. So the CE grip is where you've got the C here and the E here, as you can see. You put the seal around the mouth of the patient that fits with this mask. The C goes on top of the mask, the E goes on the chin, and you tilt the head back. Now I'm going to squeeze, look at the lungs. As you can see, they're inflating. And I'm not squeezing really hard, I'm only squeezing just enough for rise and fall, okay? Now I'm going to show you the two-handed technique. If I can have Dan with me here. Thank you, Dan. So the two-handed technique is the V grip. One thumb goes here, the other thumb goes here, and it connects that way. So as you can see, one thumb goes here, one thumb goes here, and then the fingers go on the chin, and they go back like this. Right, go for it, Dan. Good squeezing, yep. Good. And as you can see, it's a better seal. We always prefer, if you haven't got an eye gel in, to use the two-handed technique when you can, when you've got the people, because it creates a better seal. Thank you, Dan. Thank you very much.